My dearest friends, as I mentioned so many times, my job, because you're very busy, you're a student or you're a young professional or your dad, your mom, you're very, very busy in the things that are more important. My job, and I get paid very well, to summarize all this vast literature in the simplest of terms, in that little kernel of knowledge that you can easily digest it and apply in your life. Today I'm talking about bruises. So, and as you know, my favorite thing is home remedies. Home remedies, okay? So let's eliminate, for ethical reasons, professional reasons, let's eliminate the serious hematoma. So hematoma is just a collection of blood in some a body plane, okay? So, subdural hematoma. Your poor boy was playing baseball, got hit in the head by a baseball. Fell down, was a little bit out of it. Okay, this is very serious, okay? So here are the things to watch for. And that's not the purpose of this video, an exhaustive academic discussion of subdural hematomas. But I just want to cite one example of serious hematomas. So that's an intracranial bleed from a trauma like a baseball, okay, hitting the head. Now, these are the things to watch for. In the first critical 8 hours, you notice your boy returns home. At first he's doing fine. He starts to throw up. He starts to become very irritable. He takes a nap in a sofa in the living room. When you try to wake him up, he doesn't wake up well. His personality seems to have changed. This is very serious. This boy needs to be taken to the emergency room stat immediately, because, albeit very rare, a subdural hematoma can kill you, okay? So let's talk about, okay, in a car accident, you hit your chest with a steering wheel at high velocity, and you have a pericardial sac hematoma. You're gonna tamponade out your heart. You're gonna squeeze your heart with that blood, and you're gonna die. Okay, I'm not talking about that, okay? So there is exhaustive discussions on that all over the network, the internet, okay? I'm talking about that little bruise you have. You're asking yourself, my gosh, Ray, I'm constantly bruised. What's going on? Okay, so I want to talk about that today. What are the causes of the fact that you're a little bit bruised? Look, your menstrual period's too heavy. And all the clotting elements you're losing through your menstruation every 28 days. What? So you need to replace these elements. Okay, I'm going to give you some tips on how to do that. Okay? The other thing is you are a very stressful job. You're consuming too many non-steroidal anti-inflammatories, which are what? Aspirin, for example. Okay? Ibuprofen. Or, you know, in an attempt to escape your stressful life, maybe you're consuming too much wine. Or maybe you're partying too much. Alcohol itself can thin your blood. Or perhaps you don't like Latin food and you're consuming an inordinate amount of garlic. Garlic will thin your blood. Yes, it will thin your blood. So what's happening is anything you have a genetic condition, that affects the intrinsic or extrinsic clotting factors, but that's a topic for a geneticist for a different day. Okay? So of those things you can control, okay, which are environmental, like I said, aspirin, and drinking too much alcohol, and you're having very heavy periods, but you're not replacing the clotting factors. Okay, so let's talk about simple tricks for that. Pineapple. Not the industrialized pineapple that comes out of a can, okay? I'm talking fresh pineapple. You went to the grocery store and you bought a pineapple. I want you to get in the habit of eating pineapples. It's the bromelain inside a pineapple that helps you with bruising. Yes, it's in nature. It was the prophet Ezekiel that says, and the leaf, 5,000 years ago, a Jewish guy, he says, 5,000 years ago, a wonderful Jewish guy, he says 5,000 years ago, that the leaf will be your medicine. I agree with that. To some degree, I agree with that. So, pineapples are the simplest way you can control some of this bruising, okay? Of course, change your lifestyle. I'll give you a little trick. I prefer, you guys, seriously, I prefer even something as simple as non-steroidal inflammatories can give you a terrible syndrome called Rey syndrome. I prefer, if you have a moderate headache, okay, or mild headache, I kind of prefer that you come home, little trick, very simple trick for medicine. Come home, turn off the lights. Get a little rag, a little washcloth, moisten it, squeeze it, put it in the refrigerator for 10 minutes. Lay down in a dark bedroom. Use that cold compress, that little rag. It has to cover your forehead and your eyes. Miraculously, a few minutes later, your headache's gone, okay? Instead of abusing non-steroidal anti-inflammatories, which is bad really for your whole body, and it will thin your blood. Now, my brothers at my age, 40, 50, need to take 80 milligrams of aspirin, or should take, decrease the chance of a heart attack. I'm not talking about that. I'm talking about, maybe abusing aspirin because of a stressful day, okay? All right. So, bromelain in pineapple, simple home remedy, or arnica. If you lean a little more towards the cute hippie side, arnica. You can obtain arnica in any homeopathic store. And I take it the handfuls because I'm a taekwondo fighter. I'm constantly in fights, so I take arnica literally by the handfuls. And I rarely bruise. Yes, I rarely bruise. So, 2 simple home remedies. Okay, so now you hit the coffee table and you know you're a bruiser and what to do. Number 1, pressure. So you traumatize those arterioles, they popped, and then bleeding. So number 1, pressure. Number 2, elevate the part above your heart. So even if you have to lay down and put the legs, let's say you hit the coffee table, raise the leg on a couple of pillows. So pressure, elevate above the heart. So when you have something below the heart, it's going to do what? Psst, 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 psst. When it's above the heart, it's going to do what? No bleeding, okay? So, in ice, it constricts the arterioles and they stop bleeding, okay? Now let's talk about what happens if you're running around all over Europe and one beautiful day in a hotel, you find an old hematoma. A little purple ball, let's say somewhere, anywhere. Now we use heat. So at first, cold, but later, heat. Why? Now you want the arteries, the vascular system to dilate. Why? So you can remove the breakdown products of the hematoma. Remember, hematoma is going to go through the color range. It's going to start red, then it's going to be purple, then it's going to be green, and then yellow. And it follows gravity. How can that be? So maybe you got hit here, 3 or 4 days later, the bruise is here. That's correct. It follows gravity. That's right. So you got the little bump here. It's still in the purple, whatever color. Fine. Now you add heat. Same way I did the compress for your headache, now with heat. So put under the tap, get some warm water, squeeze. You have to have quite a few because they cool off very quickly, okay? Squeeze it, and it's called a compress. Put this moist, warm rag on the bruise, okay? And then massage it. You're inviting the breakdown products of that hematoma to be collected by the lymphatic system and eliminated, okay? So here are some very, very simple tricks on how to prevent hematomas, how to prevent bruising, and if it does happen, I identify the serious ones that need urgent medical care, but I'm talking about the little ones that just, make you look not as pretty, okay? So, why? Because I love you. Is that a crime? Tell me if it's a crime. Until next time, Dr. Rey, the king of beauty, the king of health. I'll see you next time.